Hello everyone. I am Dr. Priyanka Mehta, obstetrician, gynecologist, laparoscopic and fertility specialist from Deva Women's Clinic, Chennai. Today I'm going to talk to you in two series about when to meet a gynecologist and what happens when you meet a gynecologist. So when do you meet a gynecologist? So women's health we divide into four major groups. So we talk to you when you are a teenager or an adolescent, that is between 12 years and 18 to 19 years. After that, in the childbearing age, that is in the 20s and the 30s. And then we meet you in your 40s and your 50s, which is the perimenopausal or the menopausal age group, and then later on as and when required. So what happens in the teens or in the adolescents? When should a teenager meet a gynecologist? So most girls attain their menarche or they start their periods from the age of 12 and 13. So when you start your periods, the initial 2 years, the periods are going to be a little irregular, erratic. They may not occur at the same time every month. A normal period is between 21 to 35 days, or for most women and girls, it is between 28 to 30 days. The number of days the bleeding happens is for 3 to 4 days, and it should not affect your quality of life in such a way that you are not able to attend school or not able to attend college, not able to go to any kind of work. If that is happening, that your periods are really disturbing your quality of life, you have this severe pain which is not relieved by any painkillers, or your bleeding is very heavy, it is going on for more than 6 or 7 days, you have passage of clots, or the periods are happening twice a month or once every 15 days or 20 days, or if your periods are once every 2 or 3 months, you do need to meet a gynecologist, and their blood test will be advised, maybe an ultrasound will be done, and we can find out what is the problem. In the childbearing age group, that is in the 20s, after 25, or in your 30s, when you're either planning a pregnancy or you either have again the same kind of period problem, because by the time you are in your 20s, your periods should normalize and you should not be getting a very irregular period or a very erratic period or very heavy bleeding. So if there is still your period problem is persisting, that is it is not once in either 21 days or once in 35 days, or you're bleeding for more than 4 or 5 days with passage of clots, and there is very severe pain that you have to take time off work or you have to take leave, that means there could be certain problems like fibroid, which is a tumor in the uterus, or endometriosis, which is the periods which keep happening into the uterus or into the ovaries, and there could sometimes be a pelvic inflammatory disease or infection, and so you need to go and meet your gynec for a thorough checkup. In the 40s and in the 50s, that is the perimenopause. That is the time the ovaries slowly stop functioning and they start aging, and that is when the egg formation also stops happening. This is the time when you have to start taking your calcium supplements. You may also develop other medical conditions like diabetes or hypertension, and it's a very good idea to go for either a master health checkup or go to a well-woman clinic where they will do a vaginal scan for you, a pap smear is taken, and the other blood tests are also taken. Of course, anytime here you have heavy bleeding or you have pain abdomen which is not tolerable during your periods, or there is an abdominal distension, which means your tummy suddenly you feel very bloated up, or there is a loss of weight or loss of appetite, or there is problem in your passing urine or constipation, things like this. Don't ignore these common problems. Sometimes these could be sign of something very dangerous like an ovarian tumor, so do meet your gynecologist. Then we come to the postmenopausal age group, that is after the age of 45 or 50, or we keep the age cutoff as 52. If there is bleeding after a gap of 6 months, or after the age of 50, 52, still you are bleeding very heavy, or once the periods have stopped totally for 6 months, 1 year or more than that, and then you have bleeding, that is called postmenopausal bleeding. Postmenopausal bleeding can also be because of sometimes your old age, the blood vessels also become old and then they can bleed a little bit, but sometimes it could be a sign of either a tumor or a cancer in the uterus or in the cervix, which is the lower part of the uterus. So don't neglect these complaints. Along with any loss of weight or loss of appetite, do meet your gynecologist and ensure that you have a healthy life always.